to Truth Be Told. This is Dr. Walter Ackah.
And I'm Dr. Horton.
I think if you listen to the previous episode, thank you for doing that because it was about an hour and a half, 2 hours.
Yes, it was.
And even my wife was like, give me a few days. Give me a few
But you know what? You know what, Walt? It was inspiring. Let me tell you what inspired me.
Okay.
Give me a second here. So our illustrious guest inferred that she didn't remember if she'd been on with us before.
Right.
So that made me feel super forgettable. So I was like, you know what I got to do to make myself unforgettable?
Oh, goodness.
Hold on here.
Uh-huh.
What is this? I had to make sure that whoever comes on knows who this is. So if anybody's in doubt, my name is Dr. Leroy Horton. You can scan the we'll make sure it's not
we've hit a new low. We've hit a new low. This is what's
you can
happening.
Scan this QR code here, and you can takes you straight to my IG page where you can see cases and upcoming courses and all that good stuff. Shameless plug.
That was incredibly shameless. We've hit a new low. You know, we don't accept advertisement, but yet we sure enough. So, but that looks good. That looks good. I'm gonna stick to my background because I'm not as technologically sound as you are when it comes to these things. You know what I mean? So I'm gonna stick to my background. But no, the last episode was long. The last episode was you know it was it was triggering. And I think now we both had episodes where we were triggered a little bit, and I think for different reasons. And I think, I joke around by saying triggering, but I think we were just kind of frustrated at responses because we're like, wait a minute, we're trying to get you to answer questions that would benefit our listeners.
Right.
And I think that's what, I'll speak for myself. That's what irritated me at one point, right? I need you to answer the questions because we want our listeners to get something out of this. Right. We want our listeners to get as much as you possibly can out of this without us telling them anything. We want you as the guest to come on and educate and help us to basically open the curtains to the backstage of dentistry.
Right.
And to us, I mean, again, you can go on any podcast, and I'm going to say this for any future guests. You can go on any podcast, and you can do all the BS you want. But it's hard for you to come to this podcast and do BS because we'll call you out. And
at least one of us will, right?
Right. One of us will be triggered somehow. and we'll call you out. But in the end, you know what? It was a great time. So we figured this episode, let's just tone it down. And we're going to just do what I'm going to call this episode, What Would You Do? Okay. We'll do a What Would You Do? So I'm going to start off with a question for you. Okay. Gotcha. So here's a scenario. A patient comes to you and says, hey, Dr. Horton, I hear you're great. You're a wonderful guy. You're a wonderful surgeon. Okay. But so can you look at this one implant that I have here? And you're sure, why not? You're my new patient. Sure. You look at it and you realize that the implant appears to be in the sinus.
Oh, snap.
And the patient says, well, ever since I got this implant, I've had sinus issues. I have headaches, ... right? Anything. You know how they usually it's headaches, sinus issues. And I'm not saying that this does not happen, congestion and so forth. I think that the guy or girl who did the implant is at fault for this.
Okay.
Can you look at the x-ray and tell me that I'm right?
And that was the patient talking about.
That was the patient talking, saying, hey, I hear you're really good. Look at this x-ray. You right? You can tell that it's in my sinus. And you can tell that I bet you that's probably what led to this, because guess what? After I had this implant done, that's when I started developing all these problems.
Well, I'm a big proponent, honestly, of not throwing our fellow providers under the bus without having at least an extreme amount of certainty, right? And we know that the data shows that you can be into the sinus a few millimeters, and in most cases, you're not going to have any pathology. The implant will integrate just fine, can function just fine, as long as the amount of bone that's there is adequate enough to support function, right?
So you can go into the sinus a certain amount of millimeters and be perfect. Your sinus will be perfectly fine.
Right.
Okay, I want people to understand that part.
Yeah. So that being said, I would honestly pawn it off to someone that would be able to diagnose it a bit more accurately. So I would maybe refer them to an ENT, and they
And
can
what
put
would
a
an ENT be able to do more than you?
right. That's
Because
a good
you're
question.
Dr. Horton. I mean, I can
Yeah.
scan your barcode.
Yeah. That's right. um, well, the thing is, we can see two-dimensional X-rays looking from the outside in, right? We can look inside the mouth clinically. We can even take a three-dimensional X-ray, but it's still lacking information. Whereas an ear, nose, and throat doctor, they can put a scope, a tiny little camera, into your sinus, and they can actually see if there's any clinical signs of inflammation, infection, and so forth directly. Whereas for us, it's really easy even on a three-dimensional image to see hard tissue, but it's hard for us to clearly see and be able to diagnose anything soft tissue from the type of images that we take. And I think that would be the ultimate, not knowing how accurate the patient's reporting is, and not wanting to unnecessarily throw someone under the bus because they may have had a chronic sinusitis most of their life, and now they're looking for someone to blame for their most recent bout.
Yeah. Yeah. And it's so funny. A lot of patients will come expecting that you will say something negative about a previous provider. Oh yeah, that crown wasn't done right. Right, doc? Or, oh yeah, ever since I got this tooth, it hasn't felt right.
Right.
And I'm telling you when I say this, young doctors, young providers, I want you to understand this. You're not special. I promise you, if you do this, somebody else will do it to you.
Yes.
If you do this, you are opening yourself up for a lot of problems, because then you become, and I use this phrase lightly, an expert witness if it goes to litigation, because you're the one that said, and I quote, yeah, you're right, they did do something wrong, or I'm going to throw this other provider under the bus. I don't care how much you want this patient's business. Red flags need to go up.
Yes.
If a patient is coming to you wanting you to basically badmouth somebody else, I promise you they'll do the same thing to you.
Absolutely. Absolutely.
Go ahead.
Oh, I was going to say, I've had probably 3 or 4 patients over the years that came to me for an exam. After the exam, they called the office trying to get me to see if there was anything that I saw that their previous provider had done wrong. And they never mentioned that when they were in the chair. And in 3 or 4 of those cases, when I just said, listen, I can't speak to what anyone else did, I can only tell you what I see. I had lawyers call me begging me to be an expert witness, almost trying to coerce me, like, hey, listen, we'll pay you for your expert opinion. Are you sure there's nothing that you can find that you can, tell that the other guy did wrong or the other girl did wrong? And I was like, listen, I can't tell you. I was not there. I can tell you what I see. Right. But I can't tell you what anyone else did or how they did it.
Right. And you're right. Lawyers will definitely tempt you with something. They'll tempt you financially most of the time.
Oh, yeah.
Right? Because they want you to go ahead and speak for that. Because I don't know about other state and their laws and how much you can sue for punitive damage or whatever it may be. But, no lawyer will take on a case unless they know that they will win a substantial amount. And it might be 30% of the verdict. If it's financial, it'll be 30-40%. I don't know. They'll figure it out, but they'll get something. They'll find somebody. And the one thing is, in dentistry, and I'm just going to only speak for dentistry, that's all I know, they will find somebody to talk bad about another provider.
Oh, yeah.
And I'm telling you, don't do it.
Don't do it.
Don't do it. Because, and red flags are usually, again, somebody that comes to you and says, oh, what do you think about this? Or they say, I've gone for 2, 3, 4 opinions. You're my 4th second opinion.
Right.
They're clearly trying to look for something. And other people haven't given them what they want. And I'm a big proponent on giving second opinions. If you don't like what I'm telling you, go get somebody else's opinion. I promise you, I will be okay tonight. I will sleep well, knowing that you went to somebody else. for a second opinion. I actually encourage you to go.
Yeah.
Because in the end, if you are not buying into what I'm selling, what I'm trying to provide for you, we cannot work together.
No, there's got to be trust.
It's got to be trust, because you don't trust me. So
Right.
let me do something that you don't like, or let this pain last another day longer than what you expected. And the funny thing is no, you got me ranting right now. What gets me is when a patient will call you 2 or 3 days later, because they have my number. They'll call me 2 or 3 days and say, "Is it Dr. Ackah, is this normal?" And I'm like, "Oh God, yes. What's up? Is it normal for me to be in pain after you took out all my teeth? Is it normal?" And you laugh, but I always sit there and go, "Okay. So imagine if you had knee surgery.
Mm-hmm.
Do you think you'd be in pain 2-3 days out?"
Oh, hell yeah.
Yeah. Your mouth is no different.
Right.
But for some reason, tell me if I'm wrong, for some reason, people think that the mouth is a magical land where pain only lasts like 24 hours. And if it lasts any longer than that, there's a problem.
Right. You know, and I don't know what it is. I think part of it is pain in the head and neck area is hard to dissociate yourself from. I can put the knee out of my mind. I stub my toe. I can kind of ignore it. But for whatever reason, when it's central to your head and neck, it's really hard. It's almost like trying to ignore a headache.
I see. Yeah.
Right. Like your lower back is sore. I can kind of ignore it and get through the day. Right. But a headache, you're just like, oh my gosh, you know. So maybe it's that. Maybe. Because you're right. I've had patients that seem really surprised that something hurts. You know, and you know, not to be crass, but you're like, well, we just ripped out teeth. Right?
Yeah.
We just stretched your gum tissue over a whole lot of bone. Like, yeah, that's gonna swell a little bit. It's gonna hurt. And we talked about that.
Yes.
I never say it's not gonna hurt.
Right. You know? Patience, if you're listening. If a doctor says this is gonna be painless, and they're about to do surgery, literally get up and run the other way. Because they're full of expletives, and I'm not going to say, because you know, we want to be as PG as possible. But yeah, they're full of BS. They're full of cow manure. They're full
but I think this is a good segue, because you said a line that I was actually thinking about asking you today. You said something about being able to sleep at night, right? And one thing that I've always had a hard time with, I don't do well with failure in anything in life. So I know that obviously you could do everything the way the textbook says 100 times, you have 100 successes, you're going to run into the one time where you still did everything right, but the body did not react and it just failed. And I still lose sleep over that. It bothers me. Like, it doesn't, you know, affect me to where I can't work or that, you know, but I feel like these many years in, you know, and I've been practicing since 2007, I should be a bit more, you know, disconnected from that.
You can't be. You can't be. And I'm going to say the same. I feel exactly the same way. I feel bad when a procedure that I do does not work or does not go to the extent that I want. You know, if it's an implant that fails, if it's and I'll get, actually, man, we're doing very good, because I have another segue. Okay. But you're right. I it really bothers me. I remember more the failures than the success.
Yes.
I remember a lot of the failures, and it does bother me to the point where a patient's like, oh, there are some great patients out there that it will fail. And I'm like, I feel horrible. Right. Because they've gone through the months with me. Right. And we're about to be done, or they've gone through the months, they've gotten the crown on, and then they come back, you know, and it's like, oh, it failed. And I'm like, what happened? And they'll go through the whole entire thing, and they're like, yeah, it's okay. And I'm like, you know what? Here are your options. And I tell this to a lot of people. I'm like, here are your options. We could do it again. Right. You know, or, you know, if it's something that I'm just like, you know what, here's your money back. Sometimes I've given just money. Here's your money back. Right. If you really aren't happy, here's your money back. Because one thing I've learned, and maybe this is with our old age, but I've learned that it's not about the money. Like, holding on to that money is just going to cause more issues. Because now the patient's going to think they've been ripped off. They're going to talk bad about you. You know, your little barcode, they're going to scan it and then talk bad about you there too. They're going to go on Google.
Oh, let me take
There's
this shit off
nothing.
real quick.
What was it? Was it a Shakespeare? There's nothing worse than a lover scorned. There's nothing
Yeah.
worse than a patient scorned.
Yeah.
Because they will go to the ends of the earth to make sure that they talk bad about you.
Oh, 100%.
So you
100%.
might have kept that 1,500 or whatever it may be, but
Yeah.
you're gonna lose out on 15,000.
Yeah.
You know what I mean? They take it to another level. And I've just gotten to the point I'm just like giving their money back here and have it. And honestly, I'm gonna say maybe 80 to 90% of patients are like, can we do it again? Can we try again?
Yeah.
Because they don't, I mean, they've gone through the process. They don't want to just give up. There are a few that just like, yeah, just give my money back. I'm like, cool, enjoy. Sorry it didn't work out. Here you go. Not gonna leave you sleep over it. But you're right. There's a lot of times where I've felt horrible. You know what I mean? I'm like, oh my God. And then, you know, you have to tell the patient we have to do more, build the bone back up again. We have to do excess stuff. And anytime you do surgery in an area, you have so many other factors now, right? Mm-hmm. Now we have tissue that is not as pliable, movable. You know what I mean? We have scar tissue. We have so many other things. So what we had, and this is a lesson for young surgeons. Get it right the first time. That's the second time. The third time is so much harder. It's so much harder.
It's true. And I think over the years, I've come across those albatross patients where everything I've done on this one patient has just never healed ideally. Mm-hmm. Maybe not be catastrophic, but it's like every time I touch this one patient, something just goes a little left. And you're just like, is it the patient? Is it me? Yep. Like, I feel like I'm doing everything right. I'll have like a little bit of anxiety, or not even anxiety, but just this inkling, this feeling like, okay, I got to hit this one out of the park. And you finish the surgery and you're like, boom, I got it. Then you see him 2 or 3 days later and it's like, the tissue contracted, or there's like a little bit of suppuration. And you're just like, I have no idea. Yeah. And honestly, those patients, I just tell them, I say, hey, listen, every time I've done something on you, it just hasn't been ideal. Maybe you just need a different set of hands to work on you. That's it. And I'll give them either their money back or partial money or whatever,
whatever. Yeah, exactly.
And I'll refer them to somebody. I'll say, hey, so-and-so, they're a great surgeon, blah, blah, blah. I'll talk them up, and they may or may not have had successes, but I think that's okay too. It's all right to punt the ball sometimes.
Right. It's tough. I'm going to say dentistry, the worst part about dentistry to me, it's removing your ego. Because I truly believe that dentists come in with ego. We're all very egotistical. When we were in high school, college, we succeeded. Whenever you go to dental school, you were the best in your college. You got great grades. You did very well. You might have been a valedictorian. Then you basically put a bunch of egotistical maniacs all in one room, and you basically tell them to compete for number one. And you just fight with each other. You may not fight physically, but maybe sometimes physically. But you fight and fight and fight. And so then when you finish, there are two different types of dentists. There's either the ones that think, I'm still the greatest, and will always try to be that guy or girl, right? And then the ones that are like, I'm tired of this. Yeah. I'm good being here. I'm good. I graduated. I'm good here. What's the bare minimum? Right. And there's nothing wrong with that.
No,
honestly, nothing wrong with it. I think those are probably the ones that are the happiest.
Yeah.
because the other ones are always trying to strive for something more.
Right.
And those are the very much, the control freaks, the ones that feel uncomfortable if it's not within their realm of control. Right. No, I'm ask my wife.
100%.
Ask my wife. She'll tell you I'm crazy. she'll tell you I'm crazy. Ask my assistants. They'll tell you I'm crazy. Yeah. I will notice something. You got me talking. There was one time I had my assistant. God love her. So one time she was doing something and I was walking by and I saw that she had cross-contaminated my surgical area and another section. I literally was walking to go to the next room. I stopped. I said, "No, we're gonna have to go ahead and clean all that up. We're gonna have to go clean all that up." She goes, "But nope, we're gonna have to clean all that up." That bothers me to no end when I see cross-contamination. I don't know what it is, but it really upsets me. And so then she had to clean the whole room up again. I know she was I mean, I'm telling you, she was so mad at me. I know because I could tell in her. I mean, you know that look that they give you, like, you son of a ... You know,
Yeah.
that
Yeah.
was the look that she gave me, and I was like, yeah, you got to
Yes.
clean all that up. You can't see what you just did right there. You got nope. I can't. And I walked away. I basically gave her the chore and I walked away. And she was
Right.
looking at me like, are you serious? And I think it was because, and the worst part about it, I think we were behind schedule, which made
Mm.
it even worse for her because she was mad that we're already behind schedule.
Yeah.
You know what I mean? I'm irritated we're behind schedule. And then I tell her to clean up everything she just set up. So yeah, no,
See,
I'm done.
you and I, we're kindred spirits, man. Because I feel like I've had that specific scenario so many times. I was always a stickler on infection control.
Yeah.
I was always a stickler on not cutting corners.
Right. But I'm a
I don't.
germaphobe too, man. I think my
Are you really?
germaphobe. Oh God, I'm a germaphobe. I don't like. Oh, bro, don't let somebody. Like, it's amazing to me that my kids are not in a bubble. Like,
Right.
don't let some kid, like, you know how, like, some kid, some kids will pick up other stuff. And I have my niece, and my niece is here this past weekend for just, my brother came to visit. They all, like, the whole family came to visit and stuff. And I saw my niece was crawling, and she's like 7 months old, 8 months old. She's like crawling to go get something. And I say,
Right.
man, I have never run so fast. I ran and picked it up. It's like, no, you will, like, that bothers me. Right.
Right.
And you know how some people are like, oh, let kids be kids. Germs are good for them. They put stuff in their mouth. That's fine. They're building immunity. I'm like, that is the worst thing you could tell me. You know what I
Listen,
mean?
listen. One of my things that I don't, it boggles my mind. You be at the store, the supermarket, and certain people would just let their kids just sprawl out on the floor in the supermarket
Yes.
while they're waiting in line. I get so grossed out by that. Like, I won't say I'm a helicopter parent, but I never let my kids just
No.
like willy-nilly, like you said, put stuff in their mouth, crawl, roll around on strange
I
grounds.
can't.
Like
I
we can't
can't.
do that.
I can't, man. That's a whole other story, man. Let me ask you another question. Okay.
Okay.
A scenario. No, actually, more of a question. Have you been reported to the board?
Oh yeah.
And do you think, because that happens, because I've been reported to the board as well, and I can tell you my story, but because that happens, do you think that changes the way dentists perform dentistry? And let me give you a scenario. What happened?
Okay.
I had a previous patient of mine who actually, and we're gonna do a surprise, and I guess it's not a surprise, and I'll tell you. We're basically gonna do a short in between week episode where I recorded and had a conversation with a patient of mine who went to Mexico, because remember, one of our earlier episodes recently, we was about Molder City in Mexico.
Right.
So this patient actually went there.
Okay.
With his wife, because his wife had come to me, and I did a consultation. I said, listen, we're going to need to do like double vertical sinus lifts, and double vertical horizontal sinus lifts, and we're going to have to do a lot of stuff, and we're going to take it. And they were talking about, the restoring dentist was talking about taking a lot more teeth out and so forth. And so he went there to Molar City, Mexico, and had the procedure done at a fraction of the cost. And I don't blame him at all. But then he called me, he goes, hey, Dr. Ackah, I need your help. And I said, what's going on? Because I had worked on him, right? I'd worked on him. I'd done like 2 or 3 implants on him, and I'd worked on him, and he's a great guy. And so then he goes, hey, Dr. Ackah, like, my wife needs her sutures, her stitches removed. And I said, okay, why don't you go back to the doctor that did the surgery? And he's like, well, the problem is it's in Mexico, and I don't want to go back to Mexico to have stitches removed. Can you do it? Because I've gone to the emergency room. They refuse to do it. They've gone to other dentists and they refuse to do it.
Really? Just for stitches?
Didn't want to take it out. Didn't want to touch it.
Wow.
And I was like, yeah, sure. Come, because I knew him.
Right.
And I said, you know what? It's not a big deal. Just come and let me look at it, and we'll remove it. And honestly, the area was really good. The surgery was great. It looked great on the x-ray, but this is early on, right? So maybe we don't get all the bone that was in the x-ray, and the area healed really well. So I removed the sutures, and I was like, okay. And he was like, hey, up and down, thank you so much, you're great, da da da. You write your notes, what happened and so forth, and what you're doing. But I believe that people are so afraid of either being sued or getting sent to the board
Yeah.
That they just don't want to deal with anybody else's work.
Yeah.
You go back to that person that placed those, the stitches in there.
Yeah.
I'm not touching it. What do you think about that? Do you think that dentistry has gone backwards when it comes to that?
I think
we're here to help patients, right?
I think the law has created a lot of that. And I'll give you a personal story of when you get reported to the board, it could be for anything.
Yep.
The board will investigate it.
They have to.
If it's frivolous, you won't even know because they keep all the parties anonymous.
Right.
If they throw it out, you'll get a notification. You'll say a recent complaint was made against your license. The board investigated and found that no action was warranted.
That's
right?
it. Yeah.
Often it'll be financial. Mm-hmm. You do something, let's say the insurance was termed, but when you looked it up, it showed that it was still active. They didn't pay. Now the patient's getting a bill for what the insurance portion would have been. They don't like that, so they complain to the board. Most often it's going to be something like that, right? And so, yeah, it does make you apprehensive about tying yourself to anything that could potentially have liability. But I do know a close friend of mine, and maybe if we do have him on, he can talk about the situation, but it was one or two of his associates had worked on a patient. All he did was adjust the occlusion on this, kind of complicated prosthetic implant procedure that had been done. He adjusted the occlusion once. He was named in a suit and ended up having to come out of pocket to essentially pay lawyers and so forth. So there is some truth to the fact that if you touch it, you have bought it to some degree.
Right.
Right. Even if it's to make it go away. You got to pay lawyers to make it go away. So
you think that maybe we are reacting accordingly, which is just, hey, it's not my work. Go back to whoever. Because now you're leaving the patient basically in limbo.
You are. Right? I think it's a matter of the legal system hamstringing us, as opposed to, because honestly, if there was no liability and we could charge for it, we would do it.
Well,
right?
I think if we could charge for
it, yeah.
No, I agree with, and you can see the patient and charge the patient. You know what I mean? But what I'm saying to you is just like you said, like, have we gone too far where, one, I don't think dentists now want to be adventurous in their treatment plans.
Right.
We're as minimalist as possible. Well, for example, there's a lot of doctors that I'll talk to, and they're like, when the patient gets a root canal, I automatically do a crown. And I was like, well, that's a bit much, isn't it? And they're like, well, yeah, because in the long term, they're going to need a crown. And I'm like, but you don't know that.
Right.
You're predicting out. And they're like, well, I just don't want to have to deal with the patient coming back and saying, oh, this tooth broke and this and that. So I just put a crown on there.
Right.
And I understand their logic, but I'm like, wait a minute. Like, you haven't even given it a chance for anything to go wrong.
Right.
And then you're automatically guessing, hey, this is a worst case scenario. Or if I get close to the pulp, this patient needs a root canal. I remember we used to be like, oh, let's put the, what do they call that? The pulpal. Something to just basically protect the pulpal horns, right?
Right.
And that was my thought process. Well, you don't need a root canal unless you need a root canal.
Right.
But then people would be like, no, we're closed. Let's just go ahead and get the root canal done.
Right.
And I was like, that's a bit much to me. And I still believe that. But I honestly think that, like we were saying, it's gotten to the point where doctors just don't want to leave anything up to chance.
Right.
And I think that's what's kind of tied people's hands and made them afraid to take chances, if that makes any sense.
And to help patients, right? Because a lot of these chances, to be real, it's doing things that may not be comfortable in order to accommodate a patient. Right. But at the same time, we also have to be wary of the cowboys out there, right? How many times have you had a patient or you've seen a doctor do something where you're reading the story?
And what's a cowboy? I want you to define a cowboy for whoever's listening.
For instance, so a cowboy in
dental definition.
Where a dental definition is someone that's doing something that's extremely high risk with seemingly little caution.
Yeah.
Right. Or
little training. Or little training.
Yes.
Yes.
And so sometimes you'll read a story, and it might, God forbid, it might be a patient passed away with some type of sedation, and you're looking at the drugs used and the quantities used and the age of the patient and the health history, and you're just like, why would you take that chance?
Right.
Like I would never, like, because when you work on the human body, you're always taking some chance to a degree, right? Periodontal surgeries, 1 to 2% infection rate. So there's always a chance of something going wrong.
If it could happen, it will happen to a human body.
It will happen at one point.
If it could happen, it'll happen. Yeah.
But what you try to do, and one of my Dental Town articles, I coined this term that we are actual dental actuaries, especially in the world of perio. So an actuary is going to assess risk and assign a value to that risk. Right. Now we do the same thing, and I've seen this way more, especially in the periodontal realm. Is you're looking at everything as far as the patient, systemically, locally, habits,
right?
What they ingest, what they smoke, all that. All the classic literature and the data behind what those things or what those health issues
success
do
rates
to your incidence of potential complications of failures. And you determine a risk value for that patient. And upon that determination, you decide whether or not you're going to do this treatment, that treatment, any treatment, or whatever. Right. And that's what I that's the one thing I can say I definitely love about periodontists is they are very good actuaries when it comes to dentistry. More so than, I was as a GP or that most GPs that I know.
But do you think that that's why a lot of oral surgeons and GPs are like, my God, you do everything takes forever, and you guys are so worried about 1-2 millimeters? Because that happens. I mean, there are jokes. I have OS friends, oral surgery friends, and their jokes like, man, it takes you like 3 hours just take a single tooth out because, and they're not talking about me, but they're talking about like general, periodontists in general. That's our I guess our that's what we're known for is we take too long to do a lot of stuff that could easily be done. You know what I mean? Yeah. So maybe we're sitting there still evaluating the risk for that single tooth extraction number 8,
Right. But it's true. I think perio is very meticulous.
Right.
Good
or bad.
For good or bad. Yeah. I think in my experience, oral surgeons, there's a certain confidence level and certain kind of bravado that they plow forward. Right.
Yeah.
Then GPs, it's here, they're all over the place. Sometimes they're very cautious. Sometimes they're cowboys too.
That's it.
But I think there's a value in being somewhere, if here's cautious and here's cowboy, somewhere being slightly centered towards cautious.
Right. Well, no, there are cowboys and everything. I know a lot of perio that are cowboys.
Yeah.
I know a lot of periodontists that are cowboys that do stuff, and I'm like, where do you think that was a good idea?
Right.
Show me where you looked up that this was a good idea, because I'll see that patient because they've come to me and they're like, oh yeah, this was done and then, oh, okay. And one thing about me, and I think a lot of people that know me, I can't have my facial expression sometimes. Thank God for masks. Because there are times where I'm like, and even my assistant's like, you cannot replay poker. Because that's really God. Your face tells it all. And I'm just like, thank God for the mask, man. But I mean, there are cowboys everywhere. So I don't want people to think that we're just picking GPs or OS or whatever. Endo has them, perio has them, everybody has them, you know what I mean?
Very true.
But I guess one more thing, we'll wrap it up here. But in the end, right? Oh, one thing that a lot of people talk about, if you had a calendar in front of you and you said, this month is going to be the slowest month, and I'm going to take vacation. What month would you take vacation? If you had to pick one.
If I had to pick one.
One month would you take vacation? Because I know my answer, but what month would you take vacation?
I would probably say for me, it'd be July.
July?
Yes.
Okay.
Because I love the heat. So if we're going to go somewhere
I'm talking about you're taking vacation because dentistry is slow.
Okay. Not
Yeah,
like
not what you want. No one cares about what you want.
okay.
No one gives a crap what you want. I'm
Right.
talking about, and you know this. I'm talking about what month would you take vacation because you know it's going to be slow. Historically, it's been slow.
Historically, with us, it was always June.
June for you.
It was right when kids got out of school. Everyone started going on vacation, especially in the Northwest. So y'all down in Texas, you got hot sun all the time. Okay, we get 2 months.
We start vacation in February.
Yeah,
you know?
we get 2 to 3 months max up here. So when the sun comes out, people go crazy. So typically in my practices, it was usually June.
Okay,
we just get a lot of cancellations. People just out of town. And then September, right before school starts, everybody wanted to come in and get their checkups, their second checkup of the year before the kids go back to school.
That's so funny you say that, because for me, it's September.
Really?
Yep. So the summer is really, like you said, the school's about to let out. And in June, maybe you may have that. But the funny thing is, we usually compensate with teachers. Teachers are usually coming in and getting work done then.
Okay.
You know what I mean? So like they'll make an appointment, they'll have the consultation in like December, January, but then they'll come back for the procedure if it's an implant or whatever in June, because they're out of school now, right? And they have the 2-3 months off. And so for me, September is the worst. Because and I'm gonna just speak for Texas, that I've noticed September is the worst because everybody's already started school, right? In Texas, we usually start early. We start either in the middle of August or end of August.
Okay.
For us. And then we go straight through. Okay. So Septembers are usually big on cancellation. And that's what's happening now. Big on cancellation. It's like people sign up. You'll look at your schedule one day. You're like, oh, it's gonna be all right. You're feeling good about life. You're about to go in there. I don't drink coffee, but I'm sure you dance with coffee and stuff. And then you go there that day and you see cancellation, or you see like what happened to this? What happened to that? And you just see voids in your schedule.
Yes.
So for me, and I always say this every year, and I never take advantage. And especially now that I have my oldest that's in school now. She's in first grade now. So I'm like, I'm stuck, because I have to be here. But I would have just been like, let's go on vacation in September.
Yes.
And then there's a little tidbit for all the parents. Ready? If your kid is still in elementary school and they're not, solving the world's hunger issue, what you can do if you're going to go to Disney, this is some of the advice that I was given. If you want to go to Disney, you want to go early October, okay? Because they're getting ready for Halloween stuff. They're setting stuff up for Halloween, and everybody's still in school, right?
Yeah.
Or early December, because they're setting everything up for Christmas. So you see the Christmas lights and the parades and everything, and it's not busy because everybody's finishing up school before the winter holiday.
I like that.
So those are the two times if you really want to go to Disney World or Land and you don't want a lot of people, early October because Halloween, they're setting up for the Halloween stuff. And then early December, I'm talking about the first 2 weeks of December.
Right.
They're setting up for that.
That's good advice. I'll tell you one thing I do like about Disneyland is that they really have a system that allows for equity. And I'll tell you why.
Break that down.
When I went
financially, they're horrible people.
Well, for the people that visit, because we went to SeaWorld, and then more recently I took my kids to Six Flags.
Okay.
You buy your ticket, let's say it's $100.
Right.
You can buy the Fast Pass.
Yep.
For another $100 a person. Right. And then I don't know how families do it because it's so expensive to go to these places. So if you got a family of 5, that's $1,000 day.
Yeah.
Easy. Right.
Yeah.
But I started feeling like the biggest douchebag because me and my kids were just going on the same ride like over and over and over. And each time we're passing the same people in the line. And this kids just staring at us like, why are they going on again? Oh, it's them again. I felt so horrible.
Oh, I would have jumped out of line and fought you. If I'm standing in line and you keep going back, hey, look how happy we are.
We fighting. That's fighting. That's reason to fight. But Disneyland, you'll go there. It doesn't matter who you are. Yeah. You get your little ticket with your time. If you come back in that time, you get into the Fast Pass line and you don't have to pay for Fast Pass prices. So I do appreciate that they do that for families, because I literally, it could be most of your savings if you're a middle-class family to go to any theme park for one day if you got a couple kids.
No, I honestly, and they call that the Genie Pass now. So everything's on the app. So literally, the app runs your day.
Right.
You just look and say, oh, okay, well, I have the fast pass for this, and I can go on this, and oh, here's a timeline that you can use your fast pass, and so you basically can maneuver the park just with the fast pass and just regular rides. You know what I mean? And it was funny because we went there, I think it was June, I want to say May or June, and I forgot which one. We went to Disneyland, and I saw that the teacup ride was like 5-minute wait. You know how many times me and my kids went on that teacup ride? Because I would look at the other rides and it was like 45 minutes to an hour. And I was like, I know damn right my kids are not going to sit there for an hour. And it wasn't time for our, fast pass.
Yeah.
It's like, nah, we're going to go on this ride again. And we were like, Daddy, I'm so tired of going on the ride.
My head hurt.
Back on the ride again. Because I'm like, we're taking advantage of this day. Because as parents, you're already angry that you're there.
Yeah.
No one's happy as a parent to be there because one, the characters have learned how to maneuver around people. So even if your daughter or son sees a character they like, good luck trying to get that character to stop.
Oh yeah.
Oh, good luck. Oh, they will literally stiff arm maneuver. I've seen Barry Sanders play football, and when I say that those characters Barry has nothing on those characters.
No.
Yo, bro, the way they maneuver through
the Heisman Trophy, right? Stiff arm.
They are so swift that I'm like, they should have been playing football. And I can guarantee, I bet you Barry Sanders is in that Mickey Mouse costume because the way he was maneuvering around people was incredible to watch, man.
That's hilarious.
I was like, I see. But it is what it is, man. Let's call it this. But it just felt good. It was a chill episode. It was not stressful. It was not.
It wasn't. Do you want to tell everybody, potential guests we got coming?
Yeah.
Even without names, just
right.
What they're about.
Yeah. So for us, what we're trying to do is a little bit different from what other dental podcasts do, which is kind of bring on the same people. Oh, if you've seen them here, you've seen them here, right? What we're trying to do is show you guys the different avenues of dentistry and talk about realistic things that are happening. So if a patient will ask you like, hey, I want to, have you heard about, oil pulling? We're going to try to find somebody that does oil pulling and understands that well. If you have somebody that has TMJ issues that comes to you and say, hey, my jaw hurts. And I had a friend of mine who basically had that and contacted me. And I was like, oh, I know the right doctor who does TMJ. She'll be coming on to the episode. Awesome. We have a friend of yours who has been in business and has done the DSO model and understands it in depth. That's the kind of person we want here, right? We want people to learn from these people and to just kind of hear a different part of dentistry. I have and somebody else coming on who talks about, sleep apnea in kids.
Right.
You never think about that. Why kids sleep, have sleep apnea and how that relates to behavioral issues.
Right.
How that relates to jaw development. All these things that we don't really talk about. We understand what pediatric dentists do, right? We go to them because we don't want to deal with the kids. But there's so many other people, there's so many other things that they do, and we want to basically explore those untapped areas of dentistry. So we can.
That sounds exciting, man. I can't wait to talk to these guests. That sounds
and that's what we're trying to do. And that's why we're trying to get this. We don't, I love talking to you, but I could always talk to you without recording this.
Right.
But we want to we decided, hey, let's come on here and let's show people what dentistry really looks like.
Right.
And if they listen to our podcast and do everything, they'll come away with more information today. Dentists will come away with information. I know I learned something. Patients will come away with information because they'll be like, oh my God. Either they're going to say, man, these doctors are crazy, or wow, I didn't realize that he had to do all this stuff.
Right.
You know what I
mean? So and we're honest. And we're honest. I think we've both heard and said some things that, aren't always the most popular ideas to share. And I look at this as remote networking, because when you go somewhere, you network, you talk, you hear things, you're like, oh, I came away with 1 or 2 gems. This is what this is. You can listen to us when you're driving, when you're running, when you're multitasking, cleaning the house, you got us in your earphones. And I guarantee you, every episode we've done, there's, even for me as a participant of this show, I've always come away with, whether it's I realize something about myself, I realize what can trigger me, right?
And me, I could do. Right. I test.
But every guest that we've had so far, I've always come away with a little bit of insight that I didn't have before. And I think that's amazing.
Right. And, it's so funny. I have another doctor, and man, I'm going, but I have another doctor who actually educates foreign-born, African, Middle East doctors, dentists, I should say, Middle Eastern dentists, and gives some lectures about what's going on in dentistry now. And then he actually goes to those countries. He was just recently in Nigeria and Ghana and so forth. And he basically does community outreach when he's there. So he basically does free dentistry for those communities and partners up with different hospitals and stuff like that. So he's coming on.
Is that the brother out of Michigan?
Yeah.
I talked to him.
Yes.
Small world, man.
We connected on LinkedIn. And I said,
that is a good brother.
You got to come through. So
Yes,
so he's going
absolutely.
to come through as well. So that's, again, these are the things that like we want people to hear.
Yes.
Dentistry is not all about just, how can you increase your revenue and stuff like that. If you want to listen to that, go. There's, I bet you, thousands of other dental podcasts that you can listen to.
Yes.
We're not about that. We're about how do you get the most out of dentistry so that you can actually enjoy life. I've always said this. If you don't like it, please leave. I promise you there's somebody else going to replace you. We want people to enjoy this because dentistry is fun for us. I enjoy it. You enjoy it.
I do too.
We wouldn't be doing this.
Yeah.
Right? I could be watching football right now. I could be I could be celebrating that, my brother's Jets are not Super Bowl contenders now. That makes me happy. I'm not going to pretend it doesn't. Hey,
I'm still crying over the Seahawks performance this week.
Bro,
so,
man, it's funny that somebody said something. They were like, the highest paid quarterbacks this past weekend altogether threw one touchdown. The top 5 highest paid quarterbacks threw one touchdown. And
hey, I could have done that for half the money. Right, yeah, I could lose a game for half that contract.
It was $700 to $800 million.
Woo.
That was their total contract, and they threw one touchdown. I was like, see, this is exactly why these owners don't want to pay anybody.
Right.
So like the second they pay you, you get hurt or you throw
exactly.
Exactly. But what actually angered me, and I'm going to leave on this. What angered me is the Cowboys looked very dominant, and it really made me mad. Because I hate the Cowboys. And anybody that wants to come at me. I hate the Cowboys. I'll be the first.
Don't worry. Every year they self-sabotage.
Let's hope so.
Every year. Don't worry about it.
So. I will do a whole episode on that. I'll take pictures. I'll do diagrams to show you where they blew up and how they destroyed their season. I'll put a whole spreadsheet together.
We should do like a fantasy football episode.
Oh, okay.
Yeah.
If you're down, if anybody really cares, maybe we could do like a fantasy football, but like with like dental, like gurus or whatever, and talk about why we would pick them. We'd be like, no, I'll pick this person for this, and I'll pick that
fantasy dental team.
Yes, we could do that.
Let's do that. Okay,
we'll put it together. Look, we're just brainstorming right now. But anyway, let's get off of here, man. We'll talk soon. All right.
All right, brother.
All right, brother.
Take care.
We'll talk later.